when we see patients that need this technology or pulmonary valve replacement, this is a first-line therapy now. So to not have it is not the standard of care for our patients anymore.
The exciting thing about this Harmony valve is that we're able to treat a patient population that we haven't been able to treat in the cath lab before. So before, these patients with larger diameters of anatomy would have to go for a surgical valve replacement, which is a far more invasive procedure. Being able to do a similar procedure in this patient population allows us to do it in the cath lab.
You can put a new valve in a patient, you can put a Harmony valve in a patient, and they immediately feel better. You talk to them a week later, you talk to them 3 days later, they all say they feel better.
We have some patients that come to us with significant physical limitations. We go in and we put the Harmony TPV in, and most of them get discharged the next day. They have a few days of what we call downtime, really just to recover from the procedure itself, and then they can get back to doing what they were doing before.
Open heart surgery is scary. Anytime you're talking about your heart, it's scary. But to do it in a minimally invasive way has really kind of improved patient satisfaction.
When I meet with families as a pediatric cardiologist, they are always anticipating that the next step is going to be a procedure, because that's what their lives have been for many years. And when I can tell them that you need a new pulmonary valve, but it doesn't need to be surgery and it can be a minimally invasive approach with the Harmony TPV, you can really feel the tension in the room dissipate.
Some of my younger patients, when I speak to their parents, I tell them, yes, someday your child's going to need to have another valve.
So in my experience, all of these patients have lived their life without a functioning pulmonary valve. And they all don't really realize how symptomatic they are because of that. A lot of patients end up getting to us because they have more symptoms, they can't exercise nearly as well, they feel like they can't do their regular activities of daily life as well.
And in the medical world, when we think improvement of quality of life, we think of walking better, less heart failure symptoms, less diuretics, improvement in right ventricular function, or improvement in left ventricular function. And all of those things happen. There's no doubt that once we relieve pulmonary valve regurgitation, the RV hemodynamics improve. But if you ask the patient what they mean by quality of life, it means they can be outdoors with their kids in the park.
What's really exciting is some of my patients, after we've implanted the Harmony valve, the next day will say, I can breathe better, thank you. Even just the next day. There hasn't been enough time for the right ventricle to remodel, but they can already express that they feel better just after one day, which I find amazing.
It is great for the patients. Most of my patients are very active. They don't want to be in the hospital. They don't want to recover. They want to get back to their lives. And so they can usually stay overnight, go home the next day, and for a lot of my patients, they're back at work 2 days after the procedure.
And the peace of mind comes in the fact that knowing that you can kind of live with this and understand that your doctor and your team are going to plan your future procedures in a manner that is less invasive on your life than perhaps it was when you were a child and had to be out of school for half a year or missed large portions of school because of all the procedures you had.
I would tell other ACHD physicians that they should look into this product. The product is not for every patient, but for many of the patients that do come through our clinics, it's an excellent opportunity for them to have a functioning pulmonary valve without surgery.
I think that's really helpful for families and patients, so that when it comes time to replace their pulmonary valve, they know what their options are and know that they can come to us as the interventional cardiologist and discuss if they are a candidate for this valve.
So the idea that they have options beyond that is uplifting in many ways. And for the most part, we're able to deliver on that. So we do the work, we do the imaging, and then we're able to deliver on it, which is remarkably fulfilling for us and for the patient.